Hello. This presentation is from the National VOAD Emotional and Spiritual Care Committee. It's an introduction to the guidelines for disaster emotional care and disaster spiritual care. 3 members of the committee are involved in presenting today. My name is Blythe Fowler. I serve as coordinator to National VOAD for the International Fellowship of Chaplains. My co-presenter is Melanie Dunbar. Melanie serves as the Mental Health Chair and past president of HOPE Animal Assisted Crisis Response. We offer our special recognition and appreciation to Christian Burgess and Vibrant Emotional Health for providing technical services today and the American Sign Language or ASL interpreters. Next. The overall objectives of our presentation are to present the availability of 3 new webinars from National VOAD's Emotional and Spiritual Care Committee. Now the first is the introduction to the guidelines for disaster emotional and spiritual care. This is followed by a second called the Orientation to Disaster Emotional Care. And the third is the Orientation to the Disaster Spiritual Care Guidelines. Next, we have additional objectives, which are to overview the role of an Emotional and Spiritual Care Committee, or an ESCC. We also want to highlight National VOAD 4 C's and the points of consensus. We want to introduce practices of disaster emotional care and disaster spiritual care, as well as the written guidelines. Another objective is to compare and contrast the high points of disaster emotional care, or DEC, and disaster spiritual care, or DSC. Next, we'd like to make a statement from the committee regarding our webinar task groups. It is the intent of offering these webinars on disaster emotional care guidelines and disaster spiritual care guidelines to inform and orient our audience to the availability to the rich documents and the rich content that's within them. These webinars are not offered as vehicles for specific adaptation strategies or provider training. Rather, the webinars are intended to inspire establishing an ESCC within your state and territorial VOAD, and to develop networks of DEC and DSC providers under blue skies. Next, the role of an emotional and spiritual care committee. The first role is to look at the committee's mission, which is to foster emotional and spiritual care to people affected by disaster in cooperation with national, state, and local response organizations and other VOAD member organizations. The committee accomplishes this by embracing contributions to various mental health, faith-based, and spiritual practice groups. Further, the committee identifies specific issues of emotional and spiritual care as a component of disaster response. Next slide talks about some additional roles of the committee. It is to educate state and local VOADs and national affiliated partners about emotional and spiritual care needs in disaster. The committee hopes to promote best practices, standards, and models for effective emotional and spiritual care, to facilitate awareness of the guidelines among organizations outside of VOAD membership, and also to assist with increasing capacity by expanding informed engagement with the VOAD movement. Cooperation and communication are the first steps in building relationships to help work among partners. Cooperation and communication are first steps in building relationships to help work among partners become more efficient and effective. Coordination and collaboration are characteristics of maturing relationships between partners and indicate interdependent relying on each other to accomplish more. Turning now to the points of consensus. Points of consensus for disaster emotional care and disaster spiritual care establish the foundations of DEC and the DSC guidelines. Points of consensus promote quality by defining the specific standards, ethical, and operational principles for providers of the services throughout the disaster cycle. I'm now going to turn the presentation to Melanie to pick up. Melanie?
Okay, thank you, Blythe. First, let's start by talking about exactly what emotional care is. It's quite a broad term and definitely envelops a wide scope of services and interventions. Think of disaster emotional care as a foundation, providing support, reassurance, acceptance, and encouragement. Any crisis or disaster responder can participate in disaster emotional care and provide emotional support to those impacted in the situations in which we serve. Disaster emotional care is an aspect of crisis and disaster relief that can be provided or guided by licensed mental or behavioral health professionals. It builds on concepts of resiliency and other aspects of quality mental health care. It also builds upon the body of research in mental health and best care practices. In addition to comfort and support, it also connects impacted persons with resources at any point in the phases of the disaster cycle. The goal of disaster emotional care is to minimize the negative effects and psychological impact of crisis and disaster. It helps those needing more assistance get referred for the appropriate level of care. We can serve as the eyes and ears to identify those who are struggling more and may need additional resources and support. Disaster emotional care also promotes short-term recovery and supports return to a healthy level of functioning and long-term recovery as well. The disaster emotional care guidelines were developed in 2019. They are designed to be an aid for those providing or those who are interested in developing disaster emotional care programming. They lay out core ideas and guidelines for National VOAD members. They also serve as a reference tool for state and territorial VOADs, COADs, and other organizations working in disaster preparedness, response, and recovery, as well as the general public. These disaster emotional care guidelines lay out important components of the disaster emotional care programs. These include service development, capacity building, workforce implementation, so deployment of the people power, ethical considerations that we need to be mindful of in serving the vulnerable populations we encounter, and methods of interventions. In other words, what we do. The disaster emotional care guidelines also address diverse populations. This spans all variables: race, ethnicity, religion, socioeconomic status, and challenges with access or functional needs. This includes children, those from culturally diverse backgrounds, older adults, and those with functional or access needs. These guidelines also discuss relationships amongst disaster emotional care providers, as well as between them and other providers in the disaster and crisis response realm. In addition, you will find several appendices that can also be very useful in working in this arena. Now I'm going to turn it back over to Blythe, who will talk about spiritual care.
All right, thank you, Melanie. Let's begin by defining what disaster spiritual care looks like. First of all, spiritual matters include all matters of belief and values. Spiritual care addresses spirituality, which includes the search for meaning and purpose, one's understanding of the meaning of life, and exploration of the transcendent life, or that which surpasses or goes beyond the ordinary. Spiritual care may also have an active religious or faith-based component. Looking at the standards and principles of disaster spiritual care, first is to offer a quiet, listening presence and hospitality. Meet, accept, and respect persons as they are. Be prepared to accept expressions of anger and dismay. Respect every spiritual perspective of impacted persons by providing sensitive, appropriate care for all. Do not correct or contradict any expression of faith. And lastly, do no harm. Remember, people in crisis are vulnerable. Further on disaster spiritual care, DSC is a supportive interaction that nurtures the human spirit in coping with crisis of disaster. Interaction between a trained disaster spiritual care provider, sometimes called a DSCP, and impacted people. Chaplains often serve as disaster spiritual care providers. Disaster spiritual care can include referral to other resources, such as mental health professionals for additional assistance. DSC is a fluid, creative process delivered in many different ways across the disaster cycle. Now let's look at the disaster spiritual care guidelines. These were ratified in 2014. The guidelines establish a set in the disaster spiritual care points of consensus, and they elaborate what was published in Light Our Way. This was a guide for spiritual care in times of disaster that was published by the ESCC in 2009. The guidelines address how National VOAD members partner with local providers and communities of faith in providing appropriate, respectful disaster spiritual care. The guidelines offer recommended credentialing, and they model a standard for faith-based organizations providing disaster spiritual care. Some additional highlights of the guidelines include a section on guidance on striving for excellence for organizations and the services. The guidelines address DSC providers in shared settings, talking about skills, qualifications, credentialing, accountability, etc. There's intentional integration of DSC services within the recovery and response phases. Resources such as a fact sheet for emergency management, there's a community spiritual assessment tool, and more. An additional highlight would be the suggestions on implementing guidelines. One is to support relationship building with DEC and DSC providers using the 4 C's and familiarization with the guidelines. Invite DEC and DSC providers to participate in disaster response exercises at other VOAD meetings. Promote benefits of attending webinars 2 and 3, which are, again, the orientation to the disaster emotional care guidelines and orientation to the disaster spiritual care guidelines. We're now turning back to Melanie for some comparisons.
Let's next look at the similarities between disaster emotional care and disaster spiritual care, how they look and what they do. Both employ the principles of psychological first aid and are primarily focused on comfort and support of those impacted by crises and disasters. Both are part of the continuum, making sure individuals are referred to longer-term care and resources if needed. They also both address multicultural service delivery to those who are vulnerable in crisis and in times of grieving. Disaster emotional care and disaster spiritual care both heavily reinforce positive self-care, coping skills, and healthy decision-making. In regard to disaster emotional care and disaster spiritual care, there are also things that make them distinct and unique. Disaster emotional care addresses emotional support, fostering resilience, and addressing longer-term needs, whereas disaster spiritual care emphasizes spiritual concerns, particularly in terms of meaning and processing of current circumstances. Disaster emotional care utilizes those trained in addressing mental health needs, coping skills, and counseling strategies. In contrast, disaster spiritual care uses those trained in the array of spiritual values, beliefs, and practices, in addition to the psychological first aid and provision of comfort. Some other ways that these two areas diverge is that disaster emotional care focuses on cognitive, emotional, and behavioral strategies to help facilitate healthy coping and managing stress. Methods include crisis management and training in effective use of coping skills. Disaster spiritual care uses spiritual care skills and application of spirituality to the current context. The language used in disaster spiritual care is centered on meaning, belief, values, and faith. Religious or spiritual rituals and foundations are the heart of their interventions. I will now hand it back over to Blythe to address frequently asked questions and next steps.
All right, thank you, Melanie. Our presentation is really drawing to a close at this time. A lot of information may have been presented in a very short time with this introduction. We know that there will be frequently asked questions, and a single-page document has been prepared for this. That document is available at the National VOAD website, or www.nvoad.org/resources. You can view and download the document, which is titled FAQ, Intro to DEC and DSC Guidelines. The resources tab, I'd like to point this out, it is a drop-down menu that you'll find across the top, and it offers an array of materials that are very helpful to our members. If you have additional questions about this presentation, you may email info@nvoad.org. Now, I'd like to take the final moment here to point up the exciting additional webinars, which go into greater depth and detail on each set of the guidelines.